we are going to see the sphenoid bone. The sphenoid bone has the central part, or the body, and three projections: the lesser wings, greater wings, and the pterygoid processes. So the body of the sphenoid bone is like a cube. So we have 6 faces: the anterior face, posterior face, lateral faces, superior face, and the inferior face. So in the anterior face we have the jugulum, that is separated from the tuberculum cellae by this prechiasmatic sulcus, and we have a anterior crest, the anterior crest of the sphenoid, that articulates with the ethmoid bone. We have some olfactory channels that join or terminate in the ethmoidal channels in the ethmoid bone. Then we have in the superior face, we have the fossa for the pituitary gland, we have the tuberculum cellae, and between the tuberculum cellae and the jugulum is the prechiasmatic sulcus. In the posterior face we have the posterior clinoid processes and a quadrilateral lamina that articulates with the occipital bone. And here we have like some passage of the 3rd and 6th cranial nerves. Then we have on the lateral faces we have the channel for the cavernous sinus, and we have a middle clinoid process or a middle tuberculum that is not as high as the posterior or anterior clinoid processes. And we will have a groove for the anterior carotid artery between the lateral face and the lesser wing. And in the inferior face we have this inferior crest of the sphenoid bone. Then in the lesser wings we have this triangular shape. So the base is articulating with the body of the sphenoid, and it ends here in this sphenoid spine that is joining the lesser wing with the greater wing, and the most posterior part is the anterior clinoid process. The lesser wing has 2 faces, a superior and inferior face, and 2 borders, a anterior border here and a posterior border. So the posterior border ends in the anterior clinoid process, and the anterior border articulates with the ethmoid bone and the frontal bone. In the superior face we have the orbital lobe of the brain, and in the inferior part also orbital part of the brain, but more posterior. Then we have the greater wings. The greater wings have a anterior, posterior, and external face, and they form part of the orbit. So here we are seeing the orbit. They form part of the lateral wall and of the floor, and they form part also of the temporal fossa here and the infratemporal fossa. The greater wing has 3 borders: a interior border that articulates with the body of the sphenoid bone, a external border that is concave and articulates with the temporal bone, and a anterior vertical border, small here, that is let's say it begins from the sphenoid spine and ends at the level of the anterior clinoid process. So here we have a anterior vertical border, and then it continues with the external border. And here in the greater wing, we have some openings. So we have first the foramen rotundum for the maxillary branch of the fifth cranial nerve, then the oval foramen for the mandibular branch of the trigeminus, and the accessory meningeal artery, and sometimes the lesser petrosal nerve. Then we have the foramen spinosum, also called the lesser foramen rotundum or foramen rotundum minor, and this is for the middle meningeal branches, middle meningeal vessels, so the artery and vein. And then we have the foramen lacerum, that is this. This is cartilage, and then we will have the petrosal part of the temporal bone. So through the foramen lacerum passes the petrous part of the internal carotid artery, and after it would be then the C3 segment of the internal carotid artery. Then we have the something called the Vesalius foramen, that is here, is a little medial to the foramen oval. It is not present in every individual, and in the foramen spinosum sometimes we have like a canaliculus called the Arnold canaliculus, again not present in every person. Then we have a groove for the middle meningeal artery, that is this here. And in the external face of the greater wing, we have this. So these and these are the Meckel lingula, that are like a spine in the greater wings. So it is Meckel lingula. Then we have, here we see the foramen oval and the foramen lacerum. And then we have the pterygoid processes here. We have its base is here. They end in a bifurcation in a lateral and medial plate. The medial plate ends in a hook shape called the hamulus of the sphenoid pterygoid process, and the lateral plate has also like a spine here called the Siboney spine, and these plates are attachment for muscles, for example the lateral and medial pterygoid muscles. Between the plates we have the pterygoid fossa, and between the lateral plate and the greater wing of the sphenoid we have the infratemporal fossa. So we already saw the sphenoid bone, we saw the central part or the body, the lesser wings, greater wings, pterygoid process, and the foramina in the greater wings, and the superior orbital fissure that separates the lesser wing from the greater wing, and the optic channel in the lesser wing.